Yeah, I think it's a very special day in my life to have two very important personalities in the field of GI surgery sitting in front of me. You know, a post-independent India, as GI developed, there are certain individuals who always stand out for their work in certain focal areas, and they'll be known forever, years to come. And I have with me Dr.H.Ramesh, who is the Chief of Surgical Gastroenterology at Lakeshore Hospital, Kochi, and I have Dr. Sadiq Sikora, is head of the department at Sikora Hospital, Bangalore. Welcome, sir. Welcome to have you here. How long do you know each other? And where did your paths cross? Did you train together somewhere?
No, we did not.
No.
No, I think I should be the one answering this question, because I read a review article by Sikora and Posner, was it? In the British Journal of Surgery, was it? Yes, and it talked about pancreatic cancer and so
pancreatic entry anastomosis.
Anastomosis, yes, and so I kind of assumed that Sikora sounded like a woman, and I said I wondered where she was from, whether she was a fellow or whether. It turned out that I believe I understood later on that Sadiq had gone there for a kind of a stint there for several months. And
where was this?
In Pittsburgh.
This was in Pittsburgh. Pittsburgh.
Transplant center.
So I was a fellow in surgical oncology. And Dr. Posner was one of the faculty in surgical oncology.
So, and fast forward a few years later, there was this huge dearth of a second gastrosurgeon in my group. Somebody who had skills that I did not possess, somebody who would, sometimes your trainees are carbon copies of you, sometimes they are slightly inferior carbon copies of you, unfortunately, and sometimes they have to go out to become better carbon copies even. And so I felt a major lacuna, and I headhunted, so to speak, several people. Dr. Pradeep was one of them. But I always keep telling his wife that she didn't want to move out of Karnataka or Andhra Pradesh, or then she just scotched the idea, because otherwise Pradeep was nearly there. He was almost there. So then,
but there was a need to talk to his wife. No, but decides.
No, I went to Manipal to recruit him, talk about it, and then of course we sat down, had dinner. She was saying, Cochin, I don't know the language. She was giving all the objections, and so I knew that there was going to be a kind of an obstacle there. I tried to work around it, but it didn't work. Among the others that I tried, SGPGI was certainly at that time the institute in India, academically, in terms of when we went, there used to be a surgical gastro week where I got invited as a faculty, and I was obviously the least pretentious of the so-called faculty members, and I came from far away, and the question that was asked to me after the our first year, at the last day before we went is, I was asked to fill out a form where I was okay to attend it on my own without any support, and I promptly said yes. And they said they would give me train fare coming from Cochin to Lucknow by train. Would not be easy, but I said never mind. I said yes. That was how good that week was, and I would return after 4 days. Would not be a week; it'd be 4 days. I would return home with so much buzzing in my head that I would actually spend 2 days sitting down writing most of it and formulating my thoughts, and it was a real eye opener for somebody who's slightly isolated physically. And so when I went there, I met many people, and I was easily told that the most academic, the most organized, the most popular person in terms of taking calls from other departments. Several others I knew in SGPGI, all of them said if they call somebody else in your department, nobody would really be that fast to respond, but you would. That's what they said. So I said, this is the sort of guy I would want. So then I just really pitched very hard for him. I kept banging away. By the time he had quit, SGPGI, he had gone off to Sri Lanka, but I didn't let go, and he did join us.
Why didn't you join him?
He did. He worked for 2 years.
Oh, so your paths crossed for a while.
Yeah,
We didn't cross. They converged.
They converged.
They converged.
Then why did they diverge?
Well, I can tell you my perspective, and then Sadiq can tell you his. But I think basically, I think Sadiq can tell me.
I mean, is it very difficult to work with you?
Well, he has to tell that. So Sadiq, in the end, I think he summed it up in one sentence, that he wanted to be the final frontier in that sphere. And with my pre-existent sort of pedigree there over 15, 20, 25 years, it was kind of hard. And the worst thing that happened at that time, I can recall, is that there was a lady called Kuti Alexander who had a biliary injury elsewhere, and she came to us, and someone tried endoscopic therapy. Then she had a bleed, and she had a celiac axis obstruction. So we had to do one surgery just to do a bipolar ligation of the hepatic artery. And at that time, I met her patient's husband, and I said, look, we have a colleague who is inarguably has the maximum experience with management of biliary injuries in this country, for sure. He has experience, publications, you name it, he's got everything, and I'm going to ask him to treat you. So they went. About 45 minutes later, they came to the theatre. I was operating, but they were, his husband was in a real tizzy. He said, well, I don't want to hear anything, I want you to operate. So I realized this kind of a problem existed. I think Sadiq also perceived that, and he felt that as long as I was not going to be struck down by a stroke or something, it was kind of going to be hard. I mean, there's no harm in being honest, is there? So I recognized that fact as well. So I didn't sort of try to persuade him to go, because he was obviously so good. So on his side, he did have the satisfaction of, putting the force for a national board program in that institution, and for doing the first living related transplantation, doing a lot of things. He's if you thought I was difficult to work with, he's ages, streets ahead. Manish Gandhi was here at this meeting.
Now, are you contemporaries? What is the age difference?
Yeah,
I'm older, I'm sure.
Yeah,
By
a bit.
Not
by too much.
Now, I'll not go, I ask him why, how, and
no, you
so
should.
No, then I'm the...
Yeah.
Okay, now you've gone back to your roots.
Have I? I'm not sure.
Now, where are your roots, and why are you out of your roots?
Yeah, that's a good question. As a matter of fact, let me just get back a little bit. So, Ramesh did, and he had such a huge reputation. And we knew that there is a whole quality of work which is going on. And I wanted to get out of my comfort zone, basically. I knew that after a certain point at SGPGI, we stagnate, we keep on doing the same thing. And this looked like a great opportunity. So it will also answer your question, because a lot of people ask me when I reached Kerala and I was working there, that why Kerala? I mean, why do you come here? So I used to be, faced by that query, because when I was thinking about going there, it was always like, it's very cosmopolitan now. Now people can speak more than one language and you wouldn't feel uncomfortable. That is what I believed at that time, but that was not so. So I used to tell them that last I heard, Kerala is still part of India and I'm Indian. So I can go to any part I wish. But regarding the roots, it's very interesting that I've had a pan-India existence, as a matter of fact. I was born in Chandrapur, a place in Maharashtra. Initial childhood in Ballarpur in Maharashtra. Then I did my schooling in Hyderabad. Then I went to Delhi, did my schooling, MBBS, MS. Then I went to UP, Lucknow, spent 15 years. Then I went to Cochin I came to
Sri Lanka,
Sri Lanka and US, the two other places. So it's, I don't know what my roots are, to be very honest. I know I was born there and a lot of my family is still in Hyderabad, but we didn't have any roots, so as to say. So we are happy being the wandering sort of couple who goes around. I think average 10 years I've been in one place, except Cochin, and it's not all that he said is not true. The fact remains that I realized that language is important, and I'm an outsider there. And of course, with his presence there, it was not easy for me to, it was easy to fit in the group, but in the milieu, it was not easy. And when I got a chance to move to Bangalore, I thought it's much more easy, to deal with people, the society in terms of ability to speak languages and so on and so forth. But I think the one year I was there, and I think Rihanna was 1.5 years. I really enjoyed it.
Oh, it was wonderful.
To be very honest, it was the amount of work which we were doing, the interactions, we had a great academic program started. There was wealth of clinical material. The best part, of course, was not Lakeshore, but the place where I stayed. It was on the backwaters. I have never lived in a more beautiful place than that. So I loved my stay in Kerala. But sometimes you have to move on. You hoped that it would have been for longer, but you accept that that's what it is, and we both accepted that.
Recently, I was having a conversation with one of my anesthetic friends who's from West Bengal. He says social life is very important. Somebody from the north can settle in Hyderabad and Bangalore, but not in Chennai. Definitely not in Kerala.
I agree.
Would you say that?
I agree.
You have something to say on that?
I don't know. I maybe I'm not such a social animal as some others are. So behind again, you're moving from place to place has something to do with your own career, or your wife also has a role to play?
No, see, the thing is, I realized very early that if you get stuck in one place, you tend to stagnate. That was my impression. I know very many people who have done very well being in one place. But I always felt that, you need to keep on challenging yourself. And being in one place certainly gives you a kind of comfort zone, and you just, sort of float in that and don't tend to rise above. At least that was my thing. And each time I felt that I have gained something. I've never regretted moving. I do remember those precious times, and all have been excellent. But I don't sit and regret that, oh, I wish I hadn't done that from where I am now. Because at each stage, I think I've gained a lot, both professionally and for myself, this thing that how I've been able to evolve as a surgeon, as a person. So it's been good, actually, I don't regret that.
You have a comment on that?
No, I guess, everyone, I think...
No, my point again is saying that they always say wife is happy, life is happy. Is that wife was not very happy?
So that was the good part. She loves also to move on.
Mm-hmm.
She's not stuck on that. If at all any place she had to be stuck in, it's Mumbai, or Bombay as she calls it. So she is a total Bombayite, and she would love to stay there, but she doesn't mind moving around. And as I said, each place we have had fantastic memories, fantastic interactions with people, and we have grown, we have gained with each move.
You're a medical director of a hospital, and now you have a candidate who's worked in one place all his life, and another candidate worked in 10 places. Whom would you choose and why?
I wouldn't I wouldn't give too much weightage to that per se, but I would like to see what they did during that period. There are those, as Sadiq said, who may have stayed in the same place but kept challenging themselves in their own way, and they made progress. And the word progress is a very vague, as you know, very indefinable word. What is progress to you may not be progress to me. So in your own perspective, in the end, you are the best person to analyze what your life is taking, where your life is taking you. Often circumstances are a factor. So maybe I didn't move, I didn't go abroad, maybe I didn't do because certain circumstances, my family were responsible. Maybe that's all for the good, because it enabled me to cut down several options. Suppose a candidate, like you said, has moved from several hospitals, one to the other. It could mean that they always have a desire to move on, desire to see new territory, to challenge them, re-challenge themselves if they wish. Or it could be that they are frustrated, they are also not team players, they never gel in any society. Anything could be there.
How will you choose?
It's difficult.
Sadiq has been good wherever he was, and every time he's
so that's exactly
many who are not wanted.
You know where they've reached now.
Right.
It's not, I keep telling that you don't have to eat the whole bowl of, halwa to know how good it is. Or you just can bite off the edge of the cake to know how the cake is. So if you can't be a judge of people, then you oughtn't to sit in a medical director's post. So I think it's not how many places you've been, but what you've done with those places. And it's easy to...
Yeah, but Sadiq says that he's learned something new and earned more friends and
I'm
stuff.
certain he would have done the same had he remained in Lucknow or in... it's his perspective.
In retrospect, you agree with that?
No, he cannot, because there's no randomized option, you know. So it's just a perspective, as I said. It's what he thinks, what I think. I think if you can't keep a Sadiq, you can't keep a Sadiq down.
I'm asking this question in relation to a lot of youngsters who are not very sure whether they have to settle down in one place and do well like you did, or work in many places and do well like he did. You know, which way to choose? What should the criteria to choose that?
I don't think it's a criteria. It's like how you want to grow yourself. And as I said, if you find opportunities where you are doing, you can get there. And if it requires moving, you shouldn't be hesitant to do that. And I mean, having said that, when you asked me that whether you would have liked or not liked to move from Lucknow, I must put it on record that that was one of the best phases of my life. SGPGI was one of the best phases of my life, and nobody can take that away in any way from me, nor the what all it has given me. So, but that doesn't mean it should bind you to that place. I mean, you know that you've got this, and then you should, at least that's how I look at things, that you should be prepared to move on if required. And when we were talking and all, there was a lot. I mean, sometimes I feel nobody told me don't go from SGPGI.
Right.
And somebody said you come. So, but it's up to you, That was a brilliant phase. I grew in that phase. I could never have had such a opportunity if I hadn't taken that
Why
step.
Isn't that an addiction to you, a central institution?
No, I think it's a great place to work. I think it's a great place to work. But we also know when we work there that there are several shortcomings of the system. And you have to be either very thick-skinned to get through that system, or you should be just insensitive and say, I'll just keep on going on there. So as long as you can get the good out of that system, it's great. But when you've reached a stage where you think the system there lets you grow, then there is a period of stagnation. And it's up to you individually whether you would stagnate or you would get out, even in that system. But there are a lot of things which are wrong with that system, you know, to be very honest. And unless we correct those, we won't have the situation that we have now, that, you know, people are looking. I mean, I was just talking, and in AIIMS there are not enough takers, which is really sad. But that's what I'm trying to say, that the good is there, but to retain the people there, you need to do more. The institutions have to do more, central institutions. And in the current era, when you have so many options for people, I mean, good or bad we can't discuss, or we can discuss, but when they have options, that doesn't seem to be the first option. And that's surprising to me. I don't know. He has been through PGI Chandigarh.
That's what I want to ask him next, that both of you are brilliant academicians, great technologists, you published a lot, did primary research. Why did you not, why did you choose to continue in government sector, and what attracted to you a place like Kotatukulam was a village?
So, well, first of all, I want to say that this so-called SGPGI is a big phase. I think it's like the growth rate of countries. Like India has a 6%, 7%, 8% growth rate, where the US has 0.5%. For Sadiq to grow at 8% now will be near impossible, because so in the initial phase of his career there is always more growth. So that's very easy to document, that there is more growth. For you to be a shaker in Bangalore, or for me to do what I'm doing, whatever changes I make, whatever nuances I add, will seem only like a small thin icing on a large cake that has been built up over the years. Therefore, each one of us has gone through so many phases, and each phase has provided certain changes. I wouldn't even call it progress. I have been mentor to so many students as Sadiq has, and we have a gastro group in Kerala which is very active, as you know. And for some reason, people like Sudhindran, myself and others have been labeled with this task of speaking to our younger colleagues. And when we do that, the most common question that's been put to me is, how and why did you become a GI surgeon?
Okay, I'll put that back to you now.
Well, I said I had no idea. And I was doing a general surgery senior residency in PGI, and normally you complete 3 years, you get as much experience as you like, and then you go forward. And then this advertisement appears in the newspaper that there's an MCH course in gastroenterology. I called home to say, it must be all fixed, it must be all politicized, I don't think I stand a chance. Do you really want me to come and write the exam?
And why did you choose gastroenterology? MCH?
Because that was
why not urology? Why
that
not
was an extension of abdominal surgery, and
somebody must have inspired you during your training days that okay, abdomen is my area.
In general surgery in PGI was 85% abdomen, with some thoracic surgery thrown in, because we had all the other specialities that developed in a very advanced manner. Urology, for instance, cardiac surgery, you name it. So this was just like our ward in the general surgery ward would have everything, all the most complex gastroenterologic problems, and we were very good at managing them as residents. So it seemed like a logical extension, and in fact my consultant at that time was very disappointed to lose my services. In fact, he wrote in the testimonial that, I'm sorry to lose this man, and I think he's wasting. I think he's actually said that he's better off in this institution, or something to that effect. I don't recall the exact words, but he actually told me, he told my dad, and the same thing, and my dad said, he said in his ways he wants to go. I was astonished that year the government made it a merit-based selection, and they even published the marks, and fortuitously or otherwise I got 79 out of 80, and there was nothing anybody could do about it, and so I had an MCH seat available to me. I took it. Halfway through my MCH, even before I MCH seat, I was great friends with a gastroenterologist called Philip Augustine. That is in PGI. He was doing his DM in PGI, and we used to discuss gastroenterology problems. He used to say, yeah, why don't you come to Kerala? And I said, I can. I don't have a problem to coming to Kerala, but you know, my family is in Chennai, and I've got health issues with my family, and I don't know how to do it. Let's leave it there. And thereafter, this MCH thing, he came, and I applied for it, and a month later I was selected. And a question had come that I had to leave about a year into my senior residency. And then, of course, at a farewell kind of a group party, this question came up, what about us Kerala, are you coming? I said, let me do this MCH and then I'll see. So I came to MCH, I came to Madras, and I had fairly hostile reception, which is a mild way of putting it. And to be very
hostile because you are not a native of or you come from a central institution.
I don't know. I never try to analyze. All I felt that PGI trained me better than most of the people there. So in terms of both technique as well as theory, and theory I was like streets ahead. And therefore it took a year for me to convince my boss that I was on the right side and I was not interested in any local politics. And afterwards he became my best friend and well-wisher, to his credit. But initially it was not easy going. And so about 6 months down the line, I was saying, I'm not going to be able to survive in Chennai. Having left Madras for PGI, I had sort of lost contact with the scenario in Madras. And I realized that it was not easy to survive. It's very strange that we were paid $600 as our stipend. My wife was doing her ophthalmology and she was getting $600 too. And we had our first born at that time, and some, moron of a pediatrician labeled that boy as lactose intolerant.
Oh.
And that meant giving him Pro-Soyal, which cost a huge amount of money. And he would go through one tin of Pro-Soyal in about a day and a half. I mean, obviously the brat had a big appetite. And our stipends were not, collective stipends were not enough to meet that bill alone. So I had to then dip into what are my savings from Chandigarh, and we managed. And I said, they said you could operate and bolster your income as a postgraduate. Oh, you could do that in Madras in those days. I remember I did 3 operations. One was a gastrectomy, the other was an achalasia, Heller, done open. And the third was an anterior resection, and I did all of them with a great deal of comfort, and I had no problems, much to the annoyance and much to the disgust of the local surgeons in that particular hospital. So it was so desperate, and I said, this is something that I'm not willing to fight against. I mean, the general milieu of hostility, and so 6 months down the line, I traveled to Kutatukulam. It was a very eye-opener for somebody who had lived all his life in a large city, and the bus service is abysmal. To get to Kutatukulam, you had to change several buses. It was not easy to get there, and I got there. Once I entered the hospital, I fell in love with the place, to be honest. It had a 1000 mA, modern image intensifier, which was not available in most centers in southern India, definitely at that time. It had all the scopes. It had an operating theatre with only Martin and Esculap instruments. Even the hourglass to time your time of scrubbing was...
Aren't you the first GI surgeon there?
No, Philip Thomas was the first.
Oh.
Philip Thomas was 2.5 years senior to me in PGI.
Right.
2 years actually senior to me in PGI, and he had just joined there. And so we teamed up there. Philip left after about 4 years, but those 4 years, the hospital was bewildered by the fact that two people could work so closely in tandem. Pretty much, I think the same experience we had when Sadiq was in Cochin. Most people were quite finding it difficult to understand how things could be communicated without even communicating it, because essentially we were on the same page. So, so that's where I left. I went, and in fact, Philip Augustine, who was the gastroenterologist, he kind of thought, he told me later, he thought this guy is going to come here for a while. So I actually told him I want to learn to do ERCPs because I don't know where my career is going to take me. I want to acquire as many skills as I can. So I've got surgical skills, but I want endoscopic skills. As already OGD and colonoscopy had been taught by Jang Bahadur Dilawri. So he said, well, you can learn it. He expected me to last a year or a year and a half. But 4 years down the line, Philip Thomas left. And then I continued. And some years later, Philip Augustine left. And I was still there.
Why did they leave?
They left because they wanted to move on to better things, they said. Philip Thomas went to Bangalore, and then he went to the US. He has since become a exclusively transplant surgeon, not just as liver, but kidney. And so his career took him elsewhere because his perspectives were like that. And I must say that in a way, because I had a mentally challenged sister which I had committed to take care of, and so it pretty much meant if I was going to move, like if I were in Sadiq's place and I had to move, then I had to contemplate a plan which would encompass moving all those people, because my parents were attached to that. Right. So we had a big caravan, Sarai. Right. So we had to move the whole team to Lucknow or to Sri Lanka or wherever. So I got several opportunities to go abroad, and I used to keep those documents in my back pocket and then sit on it for long enough. Finally, those people would say, "Oh, you're not coming, are you? So we don't want you." So that happened even.
Now we get the answer why he didn't move out of.
I don't know. My wife's spouses are important. So I think Rehana and Revati were both sufficiently, generous to say that yes, if you think that's good for you, you can. I'm sure that's what Rehana would say, isn't it?
But in my house, there's a big fan of Ramesh, and he is a big fan of my wife. So I mean, I'm just like wannabe in that whole milieu. So I have to accept.
Strangely, all wives are a good fan of yours. How? Same he says my mentor. He directed me to take up surgery, and
she's a remarkably, talented and vivacious character who is.
She every chance he says that Ramesh.
I am very fond.
I mean, you sort of spotted her when she was in 3rd MBBS or something, and then he says she's.
I was furious because I sort of shepherded through a presentation in the seminar hall of.
Seminar hall, yeah.
And one of the professors said, for a 3rd-year student, that was good. I was so furious. Mm-hmm. In fact, I went to him and told him, this is not right, that you need to encourage people. Mm-hmm. This girl spent days working on it. Mm-hmm. All I did was to just give her some encouragement and saying that you can do it. But she did it all by herself. Mm-hmm. And if you can't encourage people, at least you should shut up. That's what I told him. So he didn't like it, but that's the way it is.
Sadiq, you've been in central institutions all through, and who sort of prompted you into abdominal surgery? What inspired you, and what took you to Sanjay Gandhi? Because Dr. Kapoor very fondly remembers your association. He says we are the best of friends.
So at AIIMS, there were 4 units, and the most popular one, understandably, was Unit 4, where Dr. Nandi and Dr. BML Kapoor, 2 stalwarts, were there. Everyone wanted to make a beeline for Unit 4. So Unit 1 was Dr. Chatterjee and Dr. Chatterjee is a very well-known esophageal surgeon, and Dr. L.K. Sharma, who is a great man, in my opinion. So we chose, I and my friend Hemant, who joined 6 months later, we said we'll join Unit 1. And Dr. Kapoor was also a lecturer in Unit 1. And everyone was a little surprised that this AIIMSonian people are choosing Unit 1 instead of Unit 4. And Ramesh was a senior resident. He graduated from there and then became a senior resident. So we took that and we had the best of both worlds. So Dr. Chatterjee, the dynamic anatomy wizard, he would give us surgery galore and had full confidence. Dr. L.K. Sharma was totally old school. He wouldn't let us use cautery at all. So even in a breast flap, we would hold the bleeders with artery forceps, tie with catgut, and do whole dissection with knife. And so we grew up with both schools, right? And I think that was great. And with Ramesh being there, Ardnari, we had a great time doing operating and all. And suddenly Unit 1 became a place to go. Subhash and Soin, both are Unit 1 products. So they followed me in Unit 1. So AIIMS 1. But the charm was, the glamour was in Unit 4. And then when I was about to finish my residency, the GI unit was established and Dr. Nandi moved to GI surgery with
Piyush and Pandey.
No.
And G.K. Pandey.
No, the gastroenterologist, Dr.
Tandon.
B.N.
Tandon.
So he had got. So that sort of, rung a bell in my mind that this is the place to go. Both the kind of work they used to do, and we were looking at that, what they used to do. We were inspired by those people, but we had good training. So these are the two components. The inspiration was there and the training was here, which I'm really very happy about. And then what happened is I was to finish my senior residency and I didn't see any opportunity for a faculty position in AIIMS. And Dr. Vinay Kapoor had moved to SGPGI as a faculty and head there. So he said, do you want to come here? And I didn't think much. I was not married, of course, at that time. Didn't think much. I said, AIIMS, I'll have to struggle, maybe there, and it may be in one of the units where I don't want it, and I want to do GI surgery. And this was a GI surgery department and a new institution which had come up. So I went ahead and joined Dr. Kapoor, and Dr. Rajan was there as a registrar there.
Which year was that?
This was 1990, and 2 months or in March, January I joined, March I got married to Rehana, and we all shifted. And imagine Rehana coming to Lucknow
from Mumbai.
It was a growing institution.
Right.
You won't believe that there was one telephone in the whole campus. It was in the guest house. We had to book calls to our parents to talk to them. There was a big queue always there. And we had good quarters. The campus was great. And I moved here. And actually I loved GI surgery from the day one. And what added to the charm of GI surgery was, of course, Dr. Kapoor and Dr. Rajan. They were young, very enthusiastic, bright. They wanted to accomplish something. Dr. S.R. Naik was the head of gastroenterology, and he had this concept that GI should be together, both medical and surgical. And it was a fantastic environment at that time. And we quickly got our act together and things went on. And then finally, Dr. Kaushik joined. And he added a lot of maturity, the vision, and the way the department should progress. And I was very fortunate to work with these people. And Dr. Kaushik posed a lot of confidence in me. He showed a lot of confidence. And he asked me one day that the MCH was going to start. He said, you want to appear for MCH and join there, or you want to be in the faculty? I thought a lot and I said, I want to be on the faculty. So we had the interviews and I was selected. and I joined as assistant professor. This was in 1991, and I personally think that is the best thing that could have happened to me as a career. And I was able to, follow these people who are my inspiration, B.M.L. Kapoor, Samiran Nandi, and could do some part of that work which they set those standards. But it was great after that. SGPGI after that was a great period.
I asked Dr. Ramesh a while ago, he was sitting here, I was sitting there, Ramesh Ardhanari, about his life. I asked him, how many marks would you give your life out of 10? He said 7.5. I said, what about 2.5? He said, I'm not organized like Ramesh H. Oh, he's got such data. And every time he opens up laptop and says, this person did that. I didn't have that, although I've done lots of work. What is your comment on that? How did you moved from a central institution to a state institution to some private institution, but you diluted more and more, but how was that the data thing continued?
No, I don't know. It's just some people are obsessed, I think.
You dreamt that one day the data will be of great
86 end is when I joined in the Madras Hospital, Kothaturam. For a year went by like a blur, and going for dandying my children over my knee and doing many operations. But I somehow felt that we needed to record things. So I had a wonderful, I had them junior doctors at that time, MBBS doctors. That guy is now a very accomplished surgeon in Thrissur. His name is Kurubala. He was my partner in crime. So on 120-page notebooks, we opened one page for every patient. The biggest challenge was when these patients came back for review. So it would take us.
Where did you get the idea from? Chandigarh?
It just happened. I don't even remember where it happened and how, but it happened, and we had a huge problem in appending data. Because the patient would come in for review, and then we spent a whole half hour locating that page because we had to add this, and we put it all in a large sheet for which you had to buy A4 sheets and paste them together and then write it like that. We had to sit on the ground and write it, and then we carried it to CMC Vellore, because I went to Kottayam Medical College, and PGI insists that you have a diploma in statistics before you pass the exam. Even if you passed your MS exam, if you didn't get the diploma, they wouldn't give you a certificate.
Really?
Wow.
Yeah. And many people try to cheat on that, but I somehow felt interested. I said I wanted to do it properly, and I think I worked hard on that, and I did a good job on the diploma in statistics. So that was there in my mind. So I went to Medical College Kottayam, and Mrs. Sarasa, Dr. Sarasa, she said, I can do mean, median, mode and all that. I can't do more than that. So I said, come on, I know I can do better than that. So I went, then they said, the only place you can do this is to go to CMC Vellore. So I wrote a letter. I was a surgeon at that time in a hospital, so I wrote a formal letter to him, P.S. Sundar Rao, saying, could you please help us with this analysis? And he wrote back graciously saying, you can come on this date. And so I took a train, land in Katpadi, and then you take a little bus to Bagayam and go into a little seedy lodge, have some breakfast and appear there. There was this guy called Jayashilan, who is, I believe, now the head of department. At times I would have sworn I wanted to kill him, because he would always be busy with the theses of those residents and give me such low priority. So he put all the data into Egret, a software called Egret, and anybody who's Egret, they must consult me, because I know so much about that software, what is wrong with that software. So Egret told us, we decided we wanted to do a multivariate analysis of factors which were responsible for poor pain relief. That was the aim. We did the analysis, and we're getting all unstable odds ratios. We couldn't understand it. So I spent a whole weekend trying to learn from the books and finding out what is to be done, and I couldn't figure out, and I put it away, came back with my tail between my legs. I used to make several visits to CMC Vellore. There was an Edicula who was a surgeon who was also interested in statistics. He used to try to help me Many of them used to keep me waiting for 2 days, and all I used to get to do is go and watch Dr. Prakash Kanduri operating or somebody operating, and then go to the library, read something. And I had begun to despair that in a year and a half nothing was happening. I went to Trivandrum for a meeting, and in the Regional Cancer Center I just happened to meet, like I met you, Dr. Shankar Narayanan, who is a radiotherapist, who at that time was deputed to WHO in Paris or something like that. And I was telling him I'm really helpless because I'm sitting in a village and I have no access to data, and so anything, and this is what I'm doing. So he said, "Great, did you say? Did they give 0 values?" I said, "I presume they did." So the point is, yes, no, you say 1 or 0, isn't it?
Right.
1 is yes and 0 is no. A-grade does not accept 0 values. You have to code them as 1 and 2. That's the catch, you see. So he said, "Do you have it?" And I had a 5.25 inch floppy disk which I was carrying in my bag. I used to carry it everywhere I went. Wherever I went, I had this bag in this object in my pocket. And sometimes these disks would malfunction because they are delicate disks, they fold. So then I would have several of them, several copies made, and gave it to him. He changed the code in like 5 minutes, and then ran a new search using the egret, and I had tangible data, tangible output, understandable, clinically relevant output within minutes. And I had goosebumps, and I told him I have to leave now because I have to study this. It's about 120 pages of printout that I had. And so I went home. I rushed home by the next. I was traveling by bus, remember? I didn't even have a car, I think, at that time. So I went home and I said, "I'm not working tomorrow. I'm off." I told the nun sisters that I had worked. So I sat all day and all night, and I had a paper ready. And that was our first publication in the British Journal of Surgery. So there there was no online, submission. So you had to send electronic typewriter versions, and send it by post. It took 3 weeks one way. Then you get a reply and they say you correct it and do this. It took a while, but it was hilarious that, that I still remember that I did acknowledge in my paper that the clinical epidemiology cell of Pittsburgh Medical College was the main reason this paper happened. But I know how easy it is now to do, any analysis or to record data. But I think recording it is critical. But Sadiq would always.
But for you, is fish to taking to water when it came to publications and statistics? So it came naturally through your general surgery training, or how did you get into? Because his story is pretty difficult of floppy disks and carrying data from here and there.
No, I think from AIIMS itself, we were pushed into publishing, and we did write a couple of papers when I was at AIIMS. But I think the value and the wealth that you have in terms of data, this was brought to us by Dr. S.P. Kaushik. So when he came to Lucknow, he had, amongst very many points, one important single point agenda was we need to capture our data well. And he would be deputing people that this resident has this data to cover, CA gallbladder, bile duct stricture, biliary injuries, so on, so forth, chronic pancreatitis. There, that time there was DBase. So the data entry was done in DBase.
Lotus 1, 2, 3.
And every resident had a responsibility, and every faculty was deputed to one area. And we realized after a couple of years that how valuable that data is. To have that, and then by that time we had all those SPSS and all that. And we could analyze that and have so many publications. So I say to everyone at each phase that auditing and data keeping is very important, whether you're going to publish or not, but for your own self. And at each institution which I've worked since then, Manipal, Sakra, and I think there also we initiated this audit thing. So the audit data is sacrosanct for us. We have monthly audit, daily all audit forms have to be filled, and that data goes into the system to be put there. And you realize over a period of time that if you don't even do very research in the form of basic sciences and other things, the clinical data which you have can give you a lot of insights, and it can also provide you the direction where you want to do research. So we really benefited from that, from the data keeping, data analysis, and I am still continuing to follow that, and I tell all my residents who come through that you should always, and we have a very simple audit form with a copy of the discharge summary at the back. So in one page you have all the information, audit form and this, and I encouraged all my people, and I see when I talk to them when they go out that, do you keep that? And they say yes, that fun form, we have followed that pattern. So I think as he has shown, as SGPGI data has shown, as we have published many things from SACRA, that data for us, clinical scientists, if we want to call ourselves, it's quite a valuable sort of wealth that we have, and we need to preserve that, make sure that we keep it nicely, appending it with follow-up and all the information that we have on that patient, and it will serve you at some time or the other, if not for publication, for improving your own self. And there are several examples I have how, looking at audit, we have sort of changed some practices, minor tinkering of those things, and we notice that things have changed and improved. So yeah, that's where I got the data from. Dr. S.P. Kaushal gets all the credit for that.
No, but both of you, I don't know whether you realize that you're born in an era of open surgery, then you got into laparoscopic surgery, you got into liver transplantation. I hope you got into robotic surgery as well. I mean, I know generations before you and after you will not have this unique opportunity to do that. But never did you have any feeling that, okay, laparoscopy is not for me, or transplant is not for me, robo is not for me?
Let me take that. This is what I said when I said that I grew a lot in this, because at SGPGI we used to do laparoscopy but not advanced laparoscopy. When I got out, I reached here, I saw a lot of things being done, I sort of got exposed to them, means first hand exposure, and I realized that it is a great tool. So I sometimes believe that if you don't have the opportunity to do, you take the recourse by saying, oh, maybe it is not good enough, or it's not. So I totally agree with you, and I tell many people that in my career, if I have gone through, you won't believe, there was no ultrasound when we started. We used to do OCGs for diagnosis of cholecystitis. And then when ultrasound came, we were like, maha thrilled, there's a appointment we can get for ultrasound, and somebody is going to do an ultrasound for our patient. So we have seen that to now MR, PET and things in EUS in terms of investigation, and from open surgery to now, as you said, laparoscopic, advanced laparoscopic. Most people perhaps don't believe that I am a laparoscopic surgeon, but I mean, I would say that I have done everything probably except Whipple, which I think I'll never do nor will ever aim to do, and I have my reasons for that. But robotic has added another dimension to my career and to my growth as a surgeon. And I think it's an excellent tool. As like any tool, you need to use it wisely, judiciously. But I know that the the force and the driven by the industry and the way we project it, it is going to become mainstream soon enough, because we can't escape these forces in this current time. It's like what happened with laparoscopy, with robotic, it's going to happen, and I think it's got a fantastic capability to deliver. So I'm thrilled to be through all this and still learning and being a student of surgery. You also mentioned transplant. I must say that I was averse to transplant. So even when I went to Pittsburgh, I did used to peep into Starzl's OT, but I used to see blood and blood all over, and I remained in surgical oncology. When I came back, Dr. Rajan wanted to start that, and I did take up the responsibility of the recipient surgery of hepatectomy. I enjoyed it actually, and then when we came to Kochi, there was this big team and we were all gearing up for that. Prakash was there, Ramesh was there, and so we all got into it, and that was also a very exciting phase. I got to learn a lot of things on transplant. It gave me a little bit of push to pursue transplant, and then when I moved to Manipal and Sakra, we developed a team and we did transplant. The only thing I'll say is that having done transplant, I know I can be part of a team which can do a transplant and do also complex things, but it's not something which really drives me and excites me tremendously. So I've done that, I'm happy about it, but I've never been so sort of pushed to pursue transplant to its limit that I should only be a transplant surgeon. So that's maybe one thing which I have not liked or have pursued and given up. That's overall, as you said, I think we are an exciting generation,
Right.
going through all these and learning continuously, upgrading our skills and knowledge.
Yeah, and I mean, you're exception actually in that generation, that you tried everything. There are many your contemporaries who stopped somewhere, that this is not my area, or they didn't have an opportunity. I mean, ego is another thing, that youngsters doing a lot of better things than you do in laparoscopy or transplant, that you don't want to be seen as somebody not that good. What is your take? How did you get into all this?
No, I'm not a thinker. So, and I just want to mention here that where one gets to is often a measure of not just yourself but your environment. So often it would be churlish to suggest that somebody said enough is enough. Why did they say that? Do you have all the data to analyze and say why they said it? It may have been personal reasons, it may have been environmental, professional reasons. So I think therefore I think if you have been able to sample all of these wells of knowledge, all you can say is that you're lucky to have done so. But did you drink deep of that well? The answer is we don't know. So why must we analyze this whole process? What we do, I mean, I don't get to do many things in my life for various reasons, and it's very hard to comprehend what those reasons are. Mostly even the subjects themselves are unable to comprehend, and for another person to do so is absolutely impossible. So I was just going to say that Sadiq's reference to clinical audit is quite commendable, and I can it's always nice to talk about a humorous anecdote that 6 p.m. on a Friday evening, one of our residents, who is now an accomplished surgeon in Ahmedabad and who was an attendee at this meeting, calls me to say, sir, tomorrow I can't do audit because Shali hasn't given me the audit sheets. she's supposed to pick up from the all the patients, and then she's supposed to deposit it on his desk, and he will collate it and present it the next morning on Saturday morning. So so we're having a party. We're basically having, the hospital's having a party, and I was nearly there. I think Sadiq was already there, and so I said, well, if you can't, you can't. So, sir, then he said, what about Sadiq sir? So call him and tell him. Then he says, nahi sir, main kar dunga. So that is the response to your question, whereas I was a difficult man to work with. So I rest my case. So I remind Manish about it now and then, because it's just that it's important to recognize that, again, the environment. Being in an academic atmosphere, it was far more easy, perhaps, to set up standards and to run a system according to the standards. In a more private enterprise, you need to have you need to wear gloves before you punch somebody in the face, if you understand what I mean. So you can't, otherwise you can't rock the boat too much. So whereas in an academic meeting I would be forthright, because I believed that I had to contend the issue, because so many people were listening and there was a chance of another opinion being expressed. Whereas on a personal level I would have stopped short, because the environment also defines you. You're never able to do exactly what you want. Nobody is. And we all allow ourselves to be shaped by our environment. So that's, I don't know if you recall this, but
on a lighter note, what is that you like about Sadiq? Have you gained anything by his association?
Of course. He's absolutely honest as far as I am concerned, so which is enough for me. He can be he can have any number of negatives, but this is enough.
Some negatives you can name?
Oh, he's very short-tempered.
Really?
Yes, absolutely.
Really?
I don't know, that's what he says.
He's very short-tempered. That's why you can say Manish didn't want to, he wanted to submit this.
Oh.
Because he would just fly off the handle at that time.
This is news to me.
Yeah, it is. I mean, I have seen evidence of that.
Okay.
So it's okay, it's perfectly, I'm not very even-tempered myself.
Short-tempered for good things.
Obviously, I mean, everything is done, when somebody loses or they make a declaration, and the vehemence with which they say it can be interpreted by different people as showing a temper, or by being very obstinate. Anything you can say you like. That's just what you are perceiving.
Right.
So Sadiq would severally dig his heels deep and do what he wanted to do. And certainly, I don't know if his times have changed has changed his resolve, but I hope not. But
are you short-tempered at home also?
As he says, you define what is short temper.
Exactly. I mean, he's very diplomatic. I'm a little more forthright. I'm certainly affected by everything that happens around me. But over the years, I learned to temper it, to never express it. So that's something I taught myself, because I realized there's no point in railing against things that you can't control, and pretty much that area that I can't control has been expanding every day until now. It pretty much encompasses the universe, that you can't control anything. I think being a GI surgeon is a good way of cutting you down to size, because if your anastomosis leaks, everyone knows.
Yeah.
And when your children grow up, that's another learning experience, because then you realize how you need to listen more than you speak. And you have to accept that mostly they are right. So then that's a wonderful phase to be in. So both of us are in that phase. So I'm sure.
Does it mean that you have similar qualities in these areas?
I see several.
Then you can't work together.
I see several similarities, and I think several. I don't know whether my analysis is right. I see a lot of similarities. It's just that each one has their own way of leading their lives.
What do you like in him?
No, I don't
Have
want to hear
heard
that.
anything from him?
Yeah, but I will prefer to hear the negatives rather than the positives. You talk about the negatives.
I mean, I think the thing which I saw when I came to is, and he keeps on saying this also, that he is very patient when he's operating. And he says this, that if you break down a complex problem into small bits, you just keep on doing those bits and you will solve the complex problem. And I've seen that being done. And that's something which I've, appreciated and seen how it is being done. And it's remarkable how patiently he will go and deal with a problem. I think that's been one of the biggest learnings which I have got from there. Yeah, and of course he's a different man at home. So he's like, he'll be
tiger.
He's very stern. He'll be even, he will talk to you as a a colleague, but not like me as a friend or whatever when at work. And with everyone he'll be, and then when you meet him outside or at home, he'll be entirely different. And you'll say, "Isi ko mil raha tha main pura din." So you must hear this. So I used to tell him, chill man, at least sometimes chill. I mean, all the time.
Not thus?
Yeah.
Oh dear.
So one movie, I told him that I will take you to watch in a theatre. He said, I've never been to a theatre to watch a movie. So I said, Hindi movie I'll take you to watch in Cochin. And we went for Das.
Okay.
That was running, it's not my fault. I had to go for a movie. And we all sat, we all were like, kahan pahunch gaye? I mean, it was an action movie, whatever. Ramesh was like, what is this? And you have wasted my evening and this and that. And I said, but it's okay, you have to do this sometime or the other. I used to take him out for dinner, which he never used to go. So I did a lot of good to him. And Revati was very happy with that. That, I told him how to celebrate occasions. He says, kya karna hai celebrate karke? So, but
it's again upbringing. It's upbringing because I'm quite happy sitting in my chair and not doing anything or just reflecting or reading a book. Somebody else would need to go to a party or to a nightclub perhaps. Third person would like to go skiing. Fourth, I would do all of these things, but not because I desperately wanted to. I think that's the way I was brought up, and that's the way my personality evolved. And I don't think I've seen a movie in the movie theater after Das.
Das is responsible.
I think he's also cheesed off because before the interval, I recall that I predicted who the criminal was, and I was right, and that was also a matter of great disappointment for him. So he took what
it was good fun there.
So I enjoyed it because I allowed myself to be led in this matter. Even my lunch components changed because I'm such a creature of habit that I can do the same thing 66 days in a year if you like. I don't have a problem of that sort, and Sadiq loved variety. And so it was great. I used to indulge in his thought process, and even my lunch lunch components changed.
Right.
Only until he left, and the moment he left, it returned. It's old format. So I think I went to Kerala, and I never thought I'd be a clinician of this type. But the first patients who walked in through the door, by some reason, and I think this is the most profound thought that I have in my mind at all times. And I tell residents this, I tell my wife this, I tell my children this. So many of these chaps, they saw, I don't know whether when you saw me first, but when I was 27, I was 27 when I finished my MCH. It was ridiculously young, and I had done a 30 Whipple resections before I was 30. I was such a kid. And I did a Klatskin resection when I was 28. And it took me a long time, and I had to empty my bladder several times in the process. And the patients trusted you, did they not? They were letting you operate on them. So I couldn't miss my clinic for what it was worth. Over the years I operate less and less, and I believe I've infected my colleagues with the same spirit that I possessed, and they are able to do it so well that I have no. And of course, as we have a system of breaking down the procedure into, different blocks, so we pretty much, regardless of whether A, B or C operates, it's the same thing. So it doesn't matter to the patient, but the clinics do matter. So I'm happy still to sit until 9 at night and talk to the last patient, even if it took a half an hour, 1 hour. I know patients have taken, their attitudes have changed. Some of them are very, contentious. Some of them are litigious. Some of them are even abusive. That's not the majority anyway, even today. And I have to remember, I have this 36-year-old lady nurse who walks into your clinic, and then she says she has abdominal pain, and you run your hand over her tummy and there's a mass. She's a staff nurse working in Switzerland, and then you do some imaging and then you discover she has a gastric adenocarcinoma. So what does it mean? I'm the one who gets the chill down my spine even more than the patient, and I have never gotten out of it. Even today I am affected. That's probably why my hair is so white. So that patient is still alive, by the way. She got a D3 gastrectomy. She required a
palpable one.
Yeah, a palpable one. So I just keep telling my residents, please forget, don't be nihilistic. Do the right thing. Let nature take its course, and don't try to play God, and don't try to say this patient doesn't deserve a more radical operation. The ideal treatment, the Japanese have taught us that you go one number beyond the N, you can actually get a relative or absolute curative operation. So practice it. What have you got to lose? Do it safely, do it carefully. So, but that day, that lady was in disaster. I was in disaster. And she didn't leave the hospital that day till late in the evening, and she lingered back because she wanted to talk. And I spoke to her, and we are very good friends now. But I keep telling her, you're not a patient anymore. So this is one of the biggest jokes I have at least I think doctors have a habit of, like, say you do an endoscopy on somebody and then he becomes your patient and he remains your patient for life. Yeah. And doctors will keep saying, wo to mera patient hai. So how is he your patient? You've just given him some health care, right, and then the contract ends and that's it. Right. So she keeps telling me, nice things, and I say, well, we are quits because you got well. That's the reward that I got. And every time I think of you, I actually make an example of you to my resident and say, read the notes, damn it. See that there are 2 notes, and then the patient is still alive. So do your best. So that sort of a situation, I think one of the things that might have happened to Sadiq, I think he is as empathic as anybody I know in this big group that we are seeing here. So that's probably what drew me to him, and still does. But had he stayed in one place, he would have become as mad a clinic runner as I am. I would dare to say, simply because the weight of these medical problems is too difficult to escape. Especially if you embrace the language, the local culture. I'm not a natural Malayali, as you know. I was born in Palakkad, but I'm a kind of a dual citizen. But I can speak all these languages fluently with all the local accents and everything. But I was probably a little different, because even if I went to Hyderabad, then I would want to learn the EH and the Nakobolo Wali Hindi in 5 days. I'm desperate to learn new languages. But that's just a difference, and minor difference. But it's just that I think if you face these hardships and you feel for these guys, you go mad after some time. And so if I go back, I'm happy to see patients, and so that's why Sadiq teases me on my wedding anniversary or my birthday. I'm still seeing my patients, so he says, "What the hell?" He's right, but I'm not wrong either. So.
Ramesh, if you have to give yourself again same question of out of 10, how many marks do you give to yourself?
I have no answer. I already thought about it when you mentioned about Ramesh Ardhanari. I don't know. I think it'd be far less.
Why do you say that? Oh. What is the unfinished job, unfinished work?
No, there's a million things that I would still like to do, but circumstances, so many factors, my own inability, my own circumstances all have contrived.
Well, you're an excellent surgeon, great researcher,
the
you published a lot, you're a great teacher, a great parent, great husband. What is that you're lacking?
That's the whole problem.
You took care of your sister?
First of all, I don't want to evaluate anybody, least of all myself. But you provoke me, so I have to answer. That's all. So, if you ask me to evaluate Sadiq, I would refuse.
I'll ask him himself same question.
Yeah, he's well.
No, but you're coming with no answer to this.
Yeah, absolutely.
You have regrets in life?
Oh, I don't know. I never think back that much. So I'm afraid to think, to be honest. I believe it serves no purpose to think.
You agree with him?
No, my philosophy is different.
Yes.
What is it? How do you rate yourself?
Rating business.
Are you a contented, happy man with what you've done in life?
No, there are a lot of things I should have done as a human being or as an individual who I am. So yeah, I mean, you are not never complete. There are a lot of things which are still required to be done. You shouldn't fall for the illusion that you are perfect because you never can be. But as I said earlier, I have no regrets except one, and I always say this.
Leaving question.
I didn't pursue a career in the US when I was there. So that's sometimes I regret that. But beyond that, all places that I worked and I moved out, I don't regret that at all. I just want to touch a bit on this that, you said that are you short-tempered, are you respond, and he said that it depends on how people. The thing which affects me most is when people don't live up to or at least see their own potential. And that I see every day. And because what is this? That there is a NEET exam and somebody is at this point and takes a particular place, whereas somebody else comes to Sakra with X number of points and nobody wants to go and comes. I tell them that, why do you think that that's the decisive point? You have to make the most of your potential and see that how people can contribute in that. And when they don't do that, it makes me mad. He says you have to, tailor yourself, calm yourself and all. I lose it every day. I lose it every day. So I tell people that, I tell all of them that you are no different from anyone just because X has scored more marks, but you see that how you can enhance your potential. We all have the potential. How you can enhance, how you can use the whatever opportunity you get. The only thing I see lacking is passion. So I feel that if you have passion, you will achieve. You will overcome, you will reach there. Passion is very important. And second thing which I feel is that a lot of people, and this is for people, residents and juniors, they think after a certain stage surgery is learned by doing. I think the more you learn is by observing carefully. If you have got your basics of surgery right, and you observe, I see that how he does the coring. I watch him, I say, he's putting this hand and he's doing this. I keep that there. And then when I have to do it, I remember that and use that. That is what they all think, that by operating is where they will enhance their skills. I think it's by observation. And it pains me every day because you saw yesterday and today you are still not following that. That makes me mad when I see that. So You said, how do you rate yourself? I mean, I agree with Ramesh that it's very difficult. Maybe 2, 3. What do you say? I'm being modest.
You're nearly there.
Yeah. See, but you know, it's very difficult.
That's because I was provoked. I mean, I wouldn't be the last one to try to assess, give myself a rating or you for that matter. Because I think what floats your boat is what is important. What floats my boat is not what floats your boat. And I hate postmortems, because except if it in a specific situation where it teaches you something, I would do a postmortem on a patient who died because I want to learn from that. But I wouldn't want to do postmortems on relationships. I wouldn't do postmortems on people, because its judgment is, again, I am grateful to my children for teaching me that, because I think as they grew up, I realized how I mustn't judge X or Y or Z, because you just don't know everything about them, do you? I mean, I just say that, okay, someone dresses shabbily, you say, why the hell must he do that? Then you discover that there are some other issues which have driven him to that. Maybe he has a psychiatric illness which he has not revealed to us. Maybe he's under some serious stress at home or something like that. So we need not ask any questions. So I frequently lecture to the Indian Institute of Management and other general bodies about lifestyles and things like that. And I've coined my own word. I do.
You tell them about lifestyle?
Yeah.
And what work-life balance do they teach you?
Face?
I want to know what work-life balance he teaches them.
I do everything.
You didn't follow what you preach all the time.
So he is also Tamil. Although he's Telugu speaking, he's also Tamil speaking. So I've coined a phrase for this, and I believe it should be, in the dictionary. I call it UEE, and expanded in Tamil it means unakenge eriyudu. If you forget the laughter, uska matlab in Hindi means aapko kahan jal raha hai. So the thing that's kept me from railing and ranting and responding to all the negative influences around me is to say, what's your problem? It's Patta's life. I'm not supposed to be, putting my nose there. Maybe he's got some secret that is going to get him over the line tomorrow morning, when I'm going to still be languishing miles behind. And I've had numerous examples of why this principle works fine. If you just apply this to our lives, so much of our time is saved. Then we begin to focus on ourselves and what we can do with it. So I've always tried to get the best out of my personal life as well as my and I have such a huge, and so it's true of Sadiq as well, that huge circle of friends of all shapes, sizes and denominations, and all of this is only possible if you invest in these relationships. So, but not to judge them.
Right.
But if you judge any one of them, then you're going to ruin that relationship. So you accept Sadiq for what he is. This package is okay. It may have some, some things that you may not desire, but that's your problem. That's your problem. It's not Sadiq's problem.
No, but
isn't that true?
No, yeah, absolutely. I agree with you. I only think that when you say these, how you should be valued or what, professionally, I am a strong believer of what legacy you leave behind.
Right.
In that sense, that have you led by example, or is there anything which people would strive to follow? Have you sort of left behind a body of work or some, what should I say, some
gift, if you like.
Gift or virtues that they would, I'm only talking about as professional, whether they could follow that, and whether I am able to impart what I know to a large number of people, because knowledge which remains with me, or whatever skills I possess remains with me, is futile. It has to be disseminated. And so more and more people, if I have been able to sort of provide to them or impart to them, I think that would be the most satisfying part. And it is satisfying, because when I see some of my old residents from SGPGI also, it feels nice that they still remember that the contribution which we make to their career. So I think those are the things which will define us, if anything has to define, and only time will tell where you stand in that.
On that note, actually, talking to icons, to big shots in this field of GI surgery in their own way, I thought they are two opposite poles, but I realized that they are the same, more or less the same, and maybe that's the secret of their success. Wonderful talking to both of you, and I learned a lot. I'm sure many will learn many things from this. Thank you.
Well, it's great. Thank you for having us here. Very unusual combination, but I learned that he has some good things about me. Thank you.
But he hasn't said the same. I haven't heard that yet. So we have a
wonderful.
Thank you.
Now, food for the belly and food for the mind is the best gift you can give anybody.
Right.
So if you had to give anybody anything, it has to be one or the other or both. So that's the key. I mean, there's no point giving somebody a jacket, because it will not help. It may not even fit him.
Right.
But this is one size fits all. And it's great stuff.
Thank you
Great.
once again.
Thank you.